lot of you are confused between PCOS and ovarian cysts. They are not the same. They sound the same, but they are different. So once again, I'm going to use produce to explain. First, this lemon is your ovary. All normal, healthy women in their reproductive years will make follicles. These follicles we find all over the ovary. These follicles that we find will be all different sizes. And once a month, one follicle will win out over the others, and that is when you release your egg and you ovulate. Sorry about that, I had to grab a new marker. I have like 1,000 dried out markers here. So again, this is the dominant follicle, and once a month it should release an egg, and these are the other follicles that didn't do that. When this releases the egg, it forms what's called corpus luteum, and that helps to maintain the pregnancy until the placenta takes over. If this starts to grow, and it grows with a lot of fluid inside, it could usually be hemorrhagic, which is blood-filled, that can cause what's called a corpus luteal cyst. That's one kind of functional cyst. These follicles that didn't rupture and release an egg can also continue to grow, and they can form what's called follicular cysts. Those typically should resolve within 2 to 3 months, and they're nothing to worry about. Most women are asymptomatic when they have these cysts and don't know that they do. However, they can grow and become really large to the point where you feel pain. There's a whole other group of cysts that's called ovarian cystic neoplasms. I won't discuss that here. Those can be either benign or malignant. Those can also grow larger and become painful as well, or they can be completely asymptomatic until they're found incidentally on the sonogram. Women with these kinds of enlarging cysts may present to the doctor's office with pain, and if we find them on the sonogram and they're not concerning, then we'll just monitor them. Or they present to the emergency room in acute pain. This can be when the cyst grows really large to the maximum point of tension and then it ruptures. On a sonogram, we'll typically see fluid in the pelvis. Or it could be a medical emergency when the cyst grows so large the ovary turns on itself and cuts off the blood supply to the ovary, and that can cause pain. This will require surgery to detorse the ovary. Now let's get to polycystic ovaries. Polycystic ovaries are small sub-centimeter follicles that are on the periphery of the ovary. Poly many, cis, PCOS. Finding this on a sonogram can mean that a woman has PCOS, but not necessarily. Not finding it on the sonogram doesn't mean that she doesn't have PCOS. These small follicular cysts in PCOS shouldn't cause pain. Women with PCOS can make ovarian cysts like we discussed before, and those can cause pain, but the classic follicular cysts that surround the ovary in PCOS should not.